Next, we have Dr. Julie Zhu. Dr. Julie Zhu is doing the ABCDs of hepatitis. Well, she'll be covering viral hepatitis A, B, C, and D. Dr. Julie Zhu is a gastroenterologist and hepatologist at Dalhousie University, where she's an associate professor in the GI division. Her clinical and research focus is on viral hepatitis B and C, as well as MASLD. And she serves on the CanHepB network, and she's also on our advisory board here at Liver Canada. So I welcome Julie up to the board.
Thank you, Ashley. Thanks everyone for coming. Let's move this closer. So I'm an adult liver specialist at QE2 Health Sciences and Dalhousie University. Thank you for having me today. So we can go to the next slide. So this is hepatitis A. Hepatitis A is a virus that can cause acute hepatitis, as we heard earlier. It's considered uncommon in Canada at the rate of 0.6 per 100,000 people in Ontario in 2022. It is uncommon in Canada in general. Estimated that 44 to 55% of hepatitis A cases in Canada are linked to travel. So it's considered a traveler's disease. We can go to the next slide. So not all people with hepatitis A experience symptoms. And so symptoms may occur about 15 to 50 days from first exposure. So typical symptoms of acute hepatitis A infection can include fatigue, nausea, vomiting, non-specifically, and abdominal discomfort is the other one. Jaundice, which means that there's yellowing of the white part of the eyes and skin, and dark urine, and low-grade fever, and loss of appetite can be non-specific. Okay, go to the next one. So hepatitis A is transmitted through eating contaminated foods. So you have increased risk of hepatitis A if you travel to regions where the hepatitis A is common, like Caribbean, South America. You can also get it from living with someone who's newly infected with hepatitis A. Drug use, like injection drugs and sharing contaminated drugs, are another risk factor. Preparation, injecting materials that's contaminated, and not practicing safe connection with others, another risk factor. Go to the next one. Thank you. How to prevent hepatitis A? There is a safe and effective vaccine that can protect you from getting hepatitis A. In addition, there are some safety precautions, and including washing your hands frequently and thoroughly, especially after using washroom, before preparing foods and before eating. Avoid raw and undercooked foods. If you are traveling to countries with high rates of hepatitis A, drink bottled and boiled water and use it for brushing your teeth as well. Drink bottled beverages without ice and avoid undercooked foods, including salads. Avoid foods from street vendors and peel and wash fresh fruits and vegetables yourself. Okay, go to the next one. We'll be moving on to hepatitis B, another virus that can cause both acute and chronic liver illnesses. Thank you. Acute hepatitis B is a short-term infection that can be treated with your own immune system alone without medication. Whereas chronic hepatitis B is a long-term infection that can occur when the immune system is unable to fight the viral infection. And how does hepatitis B spread? So from mother to baby during childbirth is a very common way to spread the virus if the mother has hepatitis B. Also intimate connections with someone who has the virus, sharing needles, syringes and drug equipment, and tattooing or piercing using unsterilized tools, sharing razor blades or toothbrushes with someone infected, as well as healthcare workers can be exposed to infected blood. We can go to the next one. Hepatitis B is a silent disease in the beginning, as individuals can have very little or no symptoms until the liver is severely damaged. Symptoms can include non-specifically fever, nausea, joint pain, jaundice again, which is yellow of the part of the eyes and skin, dark urine, fatigue, abdominal discomfort, and loss of appetite. Fairly non-specific. Go to the next one. So how do we prevent hepatitis B? Again, get vaccination against hepatitis B. There's a vaccine to prevent hepatitis B, which usually requires 3 doses over 6 months. Additionally, there's a vaccine that has a combined protection against hepatitis A and hepatitis B. Never share or reuse needles, and make sure all equipment, your medical equipment, is properly sterilized, even in a healthcare or personal care settings. Use barrier methods like condoms to reduce risk of spreading or getting hepatitis B through sexual contact. Wash your hands often and avoid sharing personal items like razor blades, toothbrushes, or nail clippers. Regularly testing. So this helps you to detect hepatitis B early so it can be treated and the risk of transmission can be reduced. Go to the next. So a simple blood test can diagnose hepatitis B. It can reveal that whether you have the virus or not, whether you had it in the past and it cleared it, which you don't require treatment for, or have been vaccinated and then protect against it, usually lifelong. So your doctor can check how your liver is working with blood tests, with liver enzymes and function tests, and they can also order additional tests. So for acute hepatitis B, your body is likely to fight off the virus, and you can just rest and avoid alcohol, and usually you get better. For chronic hepatitis B, usually you needs to be managed by antiviral medication to reduce the amount of virus in your body. While these treatments help control the infection, they do not cure the hepatitis B. Antiviral medication can reduce the viral load, as mentioned before, protect your liver, reduce your risk of liver cancer, which we heard before, and cirrhosis. So reduce your risk of having to have a liver transplant down the road, give you peace of mind, for example. So common treatment in Canada, we offer 3 types of medications, 2 formulations of tenofovir, the TDF and TAF, both available in Nova Scotia. And entecavir is the other oral agent. You can go to the next. So we're moving on to hepatitis C. Hepatitis C is another virus that can cause chronic liver illnesses. Acute hepatitis C is rare, and it's a short-term illness and can occur within the first 6 months of exposure. In some cases, the virus does run its course on its own and infection is gone, so you won't develop any chronic illnesses. For most people, though, acute infection can lead to chronic hepatitis C infection. So for about 25% of the adults, hepatitis C virus will disappear on its own. So there were about 7,500 of hepatitis C in Canada, and at a rate of 17.9 cases per 100,000 people around 2021. And men, predominantly hepatitis C infects both men and women, but more predominantly in men. 62% of hepatitis C cases occur in men. We can go to the next slide. It is spread through blood contamination, and meaning that hepatitis C infects blood, and it must reach your bloodstream before you can be infected. Risk factors are people who inject drugs, people are in a prison system, risky sexual behaviors, and immigrants and newcomers from countries where hep C is common, as well as adults born from 1945 to 1975. Go to the next one. So most individuals with hepatitis C do not experience symptoms in their early stages. If the virus is present after 6 months, it's considered chronic infection. And for most cases, only mild to moderate liver damage is present at that time. And symptoms can include fairly specifically fatigue, nausea, body aches, abdominal pain, and flu-like symptoms. Go to the next one. Chronic hepatitis C, if left untreated, can cause serious liver diseases, as we heard earlier, including cirrhosis, which means that there's significant scar tissue development in the liver over a few years, even decades. Cirrhosis can lead to liver cancer, HCC, and that can progress to symptoms associated with end-stage liver disease. This is why it's important everyone gets tested and receive treatment early. We can go to the next one. If left untreated and underdiagnosed, hepatitis C can infect other organs and cause health-related problems, including the kidney, the pancreas, the blood disorder like B-cell lymphoma, and cardiovascular disease. It can present as a vasculitis type of lesion called coaguloglobulinic vasculitis in the blood vessels. Hepatitis C is diagnosed through a blood test. And there are 2 steps in diagnosing hepatitis C. The step 1 is a hepatitis C antibody test. And if it's positive, we move on to hepatitis C RNA test performed when the antibody test is positive. This confirms the presence of virus in the blood and indicating active infection. And in terms of treatment, hepatitis C can be cured now in most people. And treatment typically involves taking 1 pill or 3 pills a day for 8 weeks to 12 weeks. And these pills are called direct-acting antivirals, DAAs. They have very few side effects, and they cure more than 95% of the people. So common treatments in Canada includes the Epclusa and Marvit, etc. So how do we prevent hepatitis C? Wound care, cover and clean any cuts or sores. Practice safe injections. Never share any needles. Never reuse any needles. Make sure your equipment is properly sterilized, even in healthcare personal care settings. And wash your hands often and avoid sharing personal items, again, like razor blades, toothbrushes, and nail clippers. And get screened. And so regular testing help detect hepatitis C early so it can be treated and the risk of transmission can be reduced. Go to the next one. So moving on to hepatitis D or hepatitis delta. So hep D is rare, but it can cause serious liver conditions. It only occurs in people who are already infected with hepatitis B. It can cause acute hepatitis D, which is short-term infection, can be treated by a patient's immune system. If not, then the person can develop chronic hepatitis D, which is a long-term infection and can occur when the immune system is overwhelmed. We can go to the next one. So how does hepatitis D spread? This is a map indicating what are the high and versus low prevalence in the world. And it's most common in countries indicated here in red. It's very uncommon in Canada and North America. So approximately 5% of people with hepatitis B also have hep D. And 1 in 6 cases of cirrhosis or scarring in the liver can be caused by hep B and D co-infection. Hep D is most common in Africa, Asia, and Europe and South America, and rarely in North America. Symptoms from hep D is similar to other viral infections. Symptoms usually occur within 2 months of exposure. Most common symptoms from this infection, again, includes dark urine and light stool, nausea, vomiting, fatigue, and fever and jaundice, and joint pains. If you have hepatitis B, and please talk to your doctor about how you can get tested for hepatitis D, especially if you were born in or have lived in regions where hep D is more common, such as Africa, Asia, and Eastern Europe, and Middle East, and South America. And if you have any risk factors like injection, drug use, blood transfusion in certain countries, or unsafe tattoo or piercing. Go to the next one. Like hepatitis B and C, hep B and D co-infection can cause more liver damage than hep B itself alone, and it's a strong risk factor for liver cancer. Hep D, again, spreads the same way as hepatitis B, through blood or bodily fluids, and that includes sharing needles or drug equipment, unprotected intimate connections, unsterilized medical and piercing or tattoo equipment. How do we diagnose hepatitis D? It is diagnosed through blood tests, and And typically, we test for hepatitis B surface antigen first. And if it is positive, then we then move on to test the hepatitis D serology. That's a blood test, and that can be confirmed by positive viral load, which indicates active infection. Go to the next one. Currently in Canada, there are 2 types of medication that can treat hepatitis D. For decades, we only had pegylated interferon alpha. And starting this year, we now have a medication called LIVERight, and is available in Canada. We recommend routine screening in people with chronic Hep B for hepatitis delta, so more people can be treated. Next slide. Yeah. And this is a summary slide. Overall, the messages are that viral hepatitis can affect anyone and are preventable. And early infection may not have any symptoms, so get screened and tested, especially if you have risk factors, and seek medical attention. Early treatment of hepatitis B and C can prevent liver-related complications and death.